We take for granted in the Western world access to dental care, doctors, eye care, but there's a lot of people around the world that aren't that lucky. Ocuwell is a company that we've been working with over the last few months to take their prototype, which is this, and turn it into something that can be mass produced. So the whole aim for this product is to give access to good quality eye care at a really cost-effective price to those people who've never had access to it before. In this video, we're going to talk a little bit about the journey that we've been on, how we got from prototype to production, and tell you about what goes on behind the scenes to take something from an idea into something that you can mass manufacture.
Ocuwell is a company that's intended to offer affordable devices to help clinical practice in ophthalmology. The research on which it's based started in 1999, was focused on corneal biomechanics and topography. With the start of the company, there had been several stages in the development of the device. We started with something very primitive. This progressed slightly, bit by bit, but actually quite fast. What we now have is something that is ergonomic, lightweight, very small. You can put it in your pocket, you can fit it on a slit lamp, you can use it as a portable device. It's easy to handle, but at the same time, it provides you with all the information you would expect from a topography device and much more.
This is an advanced prototype that's going into mass production, and we've been on the journey with Ocuwell to take what is normally a huge piece of equipment, very expensive, it's not something that's portable, you can't move it around, and condense that into something that costs a fraction of the price, therefore giving access to people around the world to good quality eye care that they've just never had before. And in this video, we're going to talk you through the journey that we've been on with them, talk you through the design process and how we arrived at this prototype that you can see today. This is Alex, Senior Product Design Engineer with us. I wanted to talk a little bit about Ocuwell as a project and the journey that we've been on with the client, what we've done internally inside the studio and how we've arrived at the position that we're at now. So Ocuwell approached us with quite an advanced prototype, but it wasn't ready for mass production. Some issues with the design for manufacture and the electronics. So working with our key partners, we redeveloped the electronics, took out some heat issues that were prominent on the PCB and gave each component an appraisal over lots of little modifications to make it toolable. We've since issued them with a suite of new pre-production samples that are going to go through to the trials, user trials and feedback to us before it goes into mass production. Alex, why don't you talk about some of the work on the internals that we did?
Yeah, so one key aspect that we improved was we identified there was an issue with the hygiene design of the device. Given this is a medical product that will be used with patients, we identified an area for improvement where the part that contacts a person's body wasn't removable and was very difficult to clean. So we came up with a way of removing that, making that a disposable and replaceable part, so it's more hygienic for use in their practice.
Yeah, I think that even the outer material, this is, whilst this is technically 3D printed and finished, it gives a sense of, I think, quality to the product as well.
Yeah.
So we hadn't used this material and this 3D printing process before, but this is recommended by one of the medical professionals that have been guiding the project. And what's really nice about this is you get a really nice finish with it. And we've been able to do things like insert magnets, so that will hold itself in position really well. It's easy to detach for the user. You can't put that in the wrong way around either. Which is, from a user experience point of view, we want to make sure that somebody who's picked this up for the first time, their experience with it is natural and it's easy, without friction. Because they have a better experience with it, they want to use it more.
So Ocuwell came to us with an advanced prototype, which they had some success with and had some issues with. They delivered the 2D and 3D data to us, which we reviewed internally, and immediately identified some areas for improvement to the mechanical design, and also the hardware, the PCB and the electronics.
Yeah, I think when we get a project like this through, the first thing that we've got to do is understand the journey that the client has been through in terms of how they got to this point in time, the decisions that they made, how they got there, what worked and what didn't. And so we have a lot of conversations with the client early on just to sort of figure out, how have you got to this point? Because some of the stuff that they've done is right. Some of it needs to be changed and adapted. So we went from that, for example, to this, in which we've addressed some of the component issues on the electronic PCB. It had a heat problem. It was generating too much heat that we had to dissipate. So we've gone through a process, and I think this is actually the third iteration that we went through to get it right. Because what we think quite often is the right thing to do turns out to be just not quite perfect. So we've changed the tracks, changed some of the components on it. We even have issues with component obsolescence, in which I think the first or the second board that we made, all of a sudden one of the key parts you couldn't buy anymore. And these are sorts of the sort of hurdles that we have to overcome on in a product development process that you just don't anticipate at the beginning.
Yeah, we also made some mechanical and functional improvements in how the product goes together, how it's used by the end user. So that could be all the way from the small things like how the two parts of the handle fit together nicely and meet the manufacturing tolerances, and how the cap is removed and replaced.
So this is it's obviously a handheld device, and we want everybody's user experience with it to be positive every time, and getting the magnet fit right, using the right magnet, specifying them, testing them, and iterating every time. It took a few goes to get that right, but I'm really pleased with the end result of this now, and this is going to go on to do a lot of good, which is right up our street in terms of our ethos at MPD, in terms of the type of projects that we want to be doing. Everything's got to do good. We're very lucky at MPD to get to pick and choose the projects that we work on. A big part of why we come into work each day is to work on products that make a positive difference. And this is, falls straight into that category of something that's going to be released around the world. It's going to help people see, which is something that we all take for granted. And it's exactly the type of product that we want to be involved with. If you've got a product and it's going to make a positive difference to the world, please pick up the phone, get in touch with our website, reach out to us, because we'd love to be involved.